Okay, let's unpack this. Today, we're diving headfirst into a condition that, well, it impacts millions of women globally, yet its origins often feel kind of shrouded in mystery. Polycystic Ovary Syndrome, or PCOS.
Hmm.
Have you ever wondered why some individuals develop it and others don't?
That is a big question.
It is. Our mission today is to pull back that curtain, exploring exactly what the leading medical texts tell us about its risk factors.
And what's truly fascinating here is how consistently the core information on PCOS uh, shows up across these definitive sources. We're talking Harrison's Principles of Internal Medicine, Williams Gynecology, Novak's
It's some
Gynecology.
heavy hitters.
Exactly. Now, they don't always give you a neat bullet point list of risk factors,
Right.
but these crucial elements are woven right into the fabric of how they describe the condition's development. So our deep dive is really designed to extract those threads for you, connecting the dots on how genetics, environment, and your body's internal processes all play a role.
And whether you're seeking personal clarity, maybe supporting a loved one, or simply curious about gaining a deeper insight into women's health, this deep dive is crafted to give you a clear, comprehensive understanding. Hopefully without getting bogged down in, impenetrable jargon.
We want those aha moments.
Exactly, those surprising facts that truly shift your perspective. So let's kick things off with what our authoritative sources identify as the, let's say, foundational pillars of PCO risk.
Okay.
And the first one is something I think many of us can intimately understand, our family tree. How much does inherited biology really shape our susceptibility to PCOS?
It's a major and remarkably consistent theme across the board. PCOS is described as a highly heritable condition,
Highly heritable.
which means it very clearly runs in families. If you have a mother, a sister, or another first-degree relative diagnosed with PCOS, your own risk is significantly increased. It's almost like there's a genetic blueprint, you could say, that primes certain individuals.
Right, like a predisposition. Now, this next insight, I found this really a game changer for how we understand PCOS, and it immediately broadens our view. It's not just that PCOS itself can run in families. Our sources reveal that a family history of type 2 diabetes is an equally potent predictor.
Yes, that connection is key.
It suggests PCOS isn't solely an ovarian issue, but maybe a systemic metabolic challenge that often echoes in a family's broader health history, doesn't it?
You've hit on a crucial point there. That connection to type 2 diabetes history is, well, it's a powerful clue. And it leads us directly to what many medical experts consider the central player, the linchpin, if you will.
Which is?
Insulin resistance. If we connect this to the bigger picture, insulin resistance isn't just like a symptom, it's a fundamental driver. It illustrates how our body's metabolic processes can directly influence hormonal balance.
Right.
It's recognized across these texts as a central risk factor and a key pathophysiological mechanism of PCOS.
Okay, so for those unfamiliar, could you simplify what insulin resistance actually means in the body? And then critically, how does that metabolic chaos translate specifically to the ovaries, where so many PCOS symptoms seem to manifest?
Absolutely. So in simple terms, insulin resistance means your body's cells don't respond effectively to insulin. Insulin is the hormone, responsible for letting glucose or sugar into your cells for energy.
Okay.
So to try and compensate for this cellular deafness, let's call it, your pancreas goes into overdrive, producing more and more insulin.
Trying to get the message through.
Exactly. This leads to chronically high levels of insulin in your blood, a condition we call hyperinsulinemia. And this excess insulin is thought to directly stimulate the ovaries to produce more androgens.
Ah, the male hormones?
Often referred to as male hormones, yes. Although women naturally produce them too, just usually in smaller amounts.
So this excess insulin isn't just floating around. It's actively driving the hormonal changes we associate with PCOS symptoms then.
Precisely. It's these elevated androgen levels that directly contribute to classic PCOS symptoms like hyperandrogenism, which shows up as things like excess hair growth and anovulation, meaning irregular or absent ovulation.
Direct link.
A crucial and very direct link. Now, what's also important to note, and this is a point our sources repeatedly highlight, is a key nuance. While obesity can definitely worsen insulin resistance, the texts are clear that insulin resistance can exist even in lean women with PCOS.
That's so important. It's not exclusively tied to weight.
Not at all, which is a common misconception.
Okay, that distinction about insulin resistance existing even in lean women is incredibly important. But of course, our sources also make it abundantly clear that obesity itself plays a monumental role in the PCOS picture, often amplifying these very effects, isn't it?
It certainly does. Obesity is not a prerequisite for PCOS, let's be clear on that.
Okay.
But it is unequivocally a significant risk factor, particularly central or abdominal obesity, that excess fat around the midsection that really exacerbates PCOS symptoms.
How so? What's the mechanism there?
Well, it creates a kind of domino effect. It directly worsens insulin resistance, which we just talked about.
Right.
It also amplifies chronic low-grade inflammation throughout the body, and it intensifies the hormonal imbalances we discussed. The sources actually describe this as a vicious cycle.
A vicious cycle. That phrase itself sounds challenging.
It is. Obesity can worsen PCOS, and unfortunately, weight gain is also a common symptom of PCOS itself, making it a really challenging situation for many women to navigate.
Wow, a vicious cycle. That really conveys such a profound challenge. It almost feels like a biological trap. It just shows how deeply intertwined these core factors are: genetics, insulin resistance, obesity.
Absolutely.
But our deep dive into these medical texts truly highlights how intricate PCOS is, because our sources then peel back even more layers. They reveal influences from things like chronic inflammation, our daily lifestyle choices, and even factors rooted in early life experiences.
That's absolutely right. Beyond those foundational components you just mentioned, chronic low-grade inflammation emerges as a subtle, often sort of silent contributor.
Okay.
Many studies cited in these texts show that women with PCOS frequently exhibit this type of ongoing subtle inflammation. And, perhaps unsurprisingly, this inflammation is tightly linked back to insulin resistance.
Yes, it connects back.
It connects back, playing a significant role in the overall hormonal and metabolic dysfunction we observe in the syndrome. It's another piece of the puzzle that really shows the systemic nature of PCOS.
So what does this all mean for daily life then? It turns out beyond our genes, our plates, and maybe even our environment might be playing a much larger role than we initially imagined.
Definitely.
It really underscores how interconnected everything in our body truly is. Our sources point to environmental and lifestyle factors as areas of, well, growing importance and ongoing study.
Indeed. When we talk about lifestyle, diet is a big one. Our texts emphasize that high consumption of refined carbohydrates and, a generally poor diet can directly contribute to hyperinsulinemia and worsen insulin resistance.
So that's a direct, modifiable link.
A very direct, modifiable link. Then there are more nascent but intriguing areas of study. The texts mention that some research suggests a potential link between certain environmental pollutants, often called endocrine disruptors,
Heard of those.
and the development of PCOS, though they clearly qualify this as an area of ongoing investigation.
So jury's still out, but something to watch.
Exactly. It's a reminder that our environment is constantly interacting with our biology. And another related area gaining traction is the gut.
Ah, the gut microbiome. It seems to come up everywhere these days.
It really does. Our sources introduce the concept of gut dysbiosis, essentially, an alteration or imbalance in the balance of your gut microbiota as a proposed contributing factor.
How would that work?
Well, it's theorized that an imbalanced gut can contribute to systemic inflammation and metabolic dysfunction, which, as we've discussed, are key elements in PCOS.
So it could be feeding into that inflammation cycle we mentioned.
Precisely. It adds another layer to that intricate web of factors.
And the plot thickens even further when we look at early life. Our medical texts highlight some intriguing conditions or events in early life that can act as developmental clues or predictors for later PCOS risk. What are some of those critical early life indicators?
One notable one is prepubertal obesity. That is, obesity developing in early adolescence or even before puberty hits.
Okay.
This is identified as a significant risk factor for developing PCOS later on. It suggests that those early metabolic challenges can kind of set the stage for the condition.
Makes sense.
Another one is something called premature adrenarche. Sounds complex.
A bit, yeah.
But it essentially means the early and maybe abnormal onset of pubic and/or armpit hair development, often before the age of 8. The texts note that this can be a strong predictor of PCOS.
Why is that?
It points towards an early contribution from the adrenal glands to that excess androgen production we talked about.
Interesting. Anything else from early life?
Well, there's a slightly more debated factor. Some studies have suggested a link between very low or very high birth weight and an increased risk of PCOS down the line.
Extreme birth weights.
Right. Though the texts usually add that this area still requires more definitive research. It's suggestive, but maybe not as firmly established as the others.
So even our earliest developmental milestones might hold clues. It really makes you think about how incredibly long-term the influences on our health can be.
Absolutely.
And finally, when we talk about fundamental aspects, we should probably circle back to excess androgen production itself. While we've discussed how insulin resistance stimulates it, the sources also make it clear that a predisposition to producing high levels of androgens, whether from the ovaries or the adrenal glands, is considered a fundamental part of the condition's etiology.
Yes, exactly. It's kind of a chicken and egg scenario that these texts carefully unpick. While hyperinsulinemia drives increased androgen production, there often seems to be an inherent, maybe genetically influenced tendency for the ovaries or adrenal glands to produce these hormones in excess in the first place.
Sure.
It forms a core part of the syndrome's very definition.
So it's both a driver and a feature.
It underscores that PCOS isn't just one thing, but a confluence of these different factors working together.
We've covered a lot of ground today, seeing how everything from our genes to our gut potentially plays a role. How do these different medical texts synthesize all of this? Do they all agree on the emphasis, or do they offer unique angles that are crucial for getting a complete understanding?
That's a great question, and this is where the power of referencing multiple authoritative sources really comes in.
Right.
They each offer perhaps a slightly different lens on the same complex condition.
Okay.
But their core agreement on the fundamental drivers like insulin resistance, genetic predisposition, is remarkably clear. Harrison's Principles of Internal Medicine, for example, tends to focus on PCOS as a complex endocrine and metabolic disorder.
Endocrine and metabolic.
Yes, emphasizing the integrated roles of genetics, insulin resistance, hyperandrogenism, and that chronic inflammation in its pathophysiology. It really paints a holistic picture of the bodily systems involved.
And then Williams' Gynecology, which is obviously a cornerstone text in women's health, it steps in by defining PCOS very clearly as the most common endocrinopathy in women of childbearing age.
Right, highlighting its prevalence.
Exactly. And it really highlights the diagnostic criteria, the Rotterdam criteria, which are crucial for actually making a diagnosis. These include things like oligoovulation or anovulation, signs of hyperandrogenism, and the presence of polycystic ovaries on an ultrasound.
The clinical benchmarks.
Precisely. And Williams also details the significant long-term health risks associated with PCOS, like the increased risk for type 2 diabetes, cardiovascular disease, even endometrial cancer. It gives us the full scope of its potential impact over a lifetime.
Then you have Novak's Gynecology, which mirrors many of these points. It discusses the pathophysiology centered on insulin resistance, ovarian steroidogenesis, which is basically the ovary's process of making hormones.
Got it.
And dysfunction in the hypothalamic pituitary ovarian axis. That's the intricate communication system between your brain and your ovaries.
The command chain, essentially.
Kind of, yes.
Yeah.
But Novak's also adds a specific, interesting detail. It explicitly mentions the use of certain medications, like valproic acid, an anti-seizure medication, as a potential risk factor.
Oh, interesting.
Yeah, alongside the more established ones like family history and prepubertal obesity. It just underscores how specific external factors can sometimes play a part too.
So when we pull all of these insights together from these, medical giants, what's the unified, overarching conclusion they present about PCOS risk factors? What's the bottom line?
In essence, they all converge on the same fundamental understanding. PCOS is consistently described as a multifactorial disorder with strong genetic and metabolic underpinnings.
Multifactorial, not just one cause.
Definitely not just one cause. And the consensus is also unequivocally clear that insulin resistance and obesity are identified as major modifiable risk factors.
Modifiable, that's key.
That is a crucial takeaway for anyone listening, whether trying to understand the condition or manage it. It highlights areas where intervention can potentially make a significant difference.
So what does this all mean for you listening? It means that PCOS is far from a simple condition, clearly, but also that understanding its multifaceted origins, from our genes and metabolism to our lifestyle and even those early life experiences, gives us powerful insights into both potential prevention strategies and managing its impacts. It's really about recognizing the intricate web of factors at play and realizing that it's a journey of understanding, not a simple single answer.
And if we connect this to the bigger picture, the intricate dance between our inherited predispositions and the environmental and lifestyle factors we navigate truly shapes our health trajectory. The ongoing research into areas like gut dysbiosis and environmental pollutants, it really suggests we're only beginning to understand the full symphony of influences on conditions like PCOS.
There's still more to learn.
Absolutely.
Absolutely.
Which raises a fascinating question, I think. As science continues to unfold these complex interactions, what else might we discover that radically shifts our understanding of what constitutes a modifiable risk? And could that offer even more pathways to support health in the future?